Welcome to our first in a series of screencast sessions on ethics, equity, and economics, defining and assessing benefits for economic evaluation and resource allocation and the market. Developed by the Millennium Human Resource Consultants and Associates for graduate students of the University of the West Indies, Health Economics Unit, Institute for Health Economic Research. Our moderator for this session is Stephen Matheson, and today he will be explaining the deontological versus the teleological ethics in health economics. At the end of this session, participants will be able to apply the ethical perspectives learned when dealing with ethical situations. Participants will also be able to evaluate and analyze challenging ethical dilemmas using the ethical principles learned in this module. What is ethics and why is it important to our practice? Most writers on ethics tend to suggest that what is ethical has its grounding in all that is seen as good and moral, and therefore ethics and morality seems to be synonymous. Morality is concerned with traditions of beliefs about what is right and what is wrong conduct. Health policy ethics is not only concerned with organizations, financing, and delivering of healthcare, but also about how it is distributed, the philosophy that determines the healthcare system. Most ethical theories can be divided into two groups, either called the teleological or the deontological theories, both of which has their roots in either utilitarianism or ethical theories of Immanuel Kant. According to the utilitarian, our obligation or duty in any situation is to perform the action that will result in the greatest possible balance of good over evil. In human healthcare terms, whatever brings about the goodness of human well-being is good, and whatever makes them worse off or harms them is evil. In other words, the teleological is essentially saying that the end justifies the means. The deontological denies that the consequences are relevant to determining what we ought to do. In other words, they deny that the end justifies the means. Kant held the view that we have a duty to perform certain acts, not because of some other benefits to ourselves or others, but because of one golden rule. He said, "Do unto others as you will have them do unto you." In other words, a wrong can only be a wrong, and a right a right. A wrong cannot be a right. We are usually guided by the oaths of our profession. Our medical doctors will usually be guided by the Hippocratical oath, while nurses and other healthcare professionals will be guided by the Florence Nightingale Pledge. Other ethical theories that guide the business of healthcare and business in general have been drawn from the work of Fredsman, 1962, who argues that the primary responsibility of organizations is to its shareholders, and so to make a profit. The business of business is business. While there are others who suggest that organizations should meet their wider need of all stakeholders, which includes those who we deem most vulnerable as healthcare professionals. Ethics, therefore, refers to the need to guide ethical decision making, and the philosophy suggests that they are sometimes distinguished by rules and policies that guides an organization. In this case, it is what guides our profession as healthcare professionals. Business are economic organizations that are supposed to operate within a certain framework of law and order in most civilized society. How ethical they are remains the personal choices of the individual or organization. Like ethics, economics plays a significant role in business decisions. Some business economics trumps, and for them the golden rule is whoever has the goal makes the rule. The reality is that economics and equity will always be on a balancing scale. On one hand, economics deal with the distribution of scarce resources, while on the other hand, equity. Let's begin by evaluating an ethical dilemma that would help us in analyzing what we have learned about the two perspectives. I once had a patient who bled massively from his inoperable cancer of the stomach. As a junior doctor, I had a strong sense that I must do my utmost for my patient. I ordered large quantities of blood from the blood bank to replace the blood the patient had lost. It was not that I believed that the blood would have cured him, but it would very probably save his life for a while longer. Whereas without the blood transfusion, he would have probably died there and then. A few days later, the patient had another massive bleed, and I again ordered more blood and set up a transfusion again. The patient survived what would almost certainly have been a fatal blood loss. The patient, knowing the situation, was keen to fight it as hard as possible. After the second massive bleed and an equally massive blood transfusion, my chief gently pointed out that there was no point in pouring in more blood. The patient's stomach was riddled with cancer and was likely to bleed whenever the cancer eroded a blood vessel. Blood transfusion could do no more than prolong the patient's life by a very short time. If I went on ordering blood at the rate I had been, I would literally break the blood bank, causing enormous expense while seriously jeopardizing the chances of other patients for whom a blood transfusion could really be life-saving, rather than merely death-prolonging. I wanted to discuss all this with the patient, but he died the same day from a further massive bleed, and at that time I simply was not called. My superior had decided that there was nothing beneficial that could be done. More precisely, however, his analysis was surely based on a different assessment. Let's take a few minutes to evaluate and analyze the ethical dilemma just presented using the principles you have learned in this session. You will be required to write your evaluations and apply some of what you learned from this session at the beginning of the next session. Let's take a few minutes also to evaluate what we have learned in the past. We first looked at the utilitarian and the teleological ethics. We said that the utilitarian ethics is decided on the end justifies the means. We looked also at Kantian ethics and the deontological ethics, which essentially says that the end does not justify the mean, and that what is good is right and what is bad is wrong, and therefore you cannot take a bad to achieve a good. We look at economics, and we said that in economics, economics is dealing with scarce resources and the allocation of it, and how it interferes with ethics sometimes. Depending on your personal ethics, you will make economic decisions. We also look at equity, and we said that equity deals with the distribution fairly of healthcare services for our profession. In our next session, we will evaluate and test learners' application of the principles learned in this session.